So welcome to this Northern Regional Health Coordinate Centre vaccine rollout webinar. I'm Bryan. I'm the facilitator. I'm Medical Director of the Royal New Zealand College of General Practitioners and a General Practitioner in East Porroa in Wellington. So the idea behind this webinar is to really update you on what's happening with the vaccine rollout in Metro Auckland. These have been extraordinarily difficult times with COVID, and we absolutely appreciate the hard work and what's been going on in the community at this point. The focus of the seminar is to really look at the final stages of the vaccine rollout from 12 years of age onwards, to look at the progress that's happening in general practice and pharmacy, to look specifically at the Māori and Pacific approach to the vaccine rollout, and to hear from experience from the Pacific experience in Metro Auckland. We'll also hear from pharmacy over their experience in the vaccine rollout, and finally a GP perspective on the vaccine rollout. The final part of the seminar will be a question and answer session. Feel free to put your questions up in the chat function on Zoom, and we'll have a look at those as time goes on. If we do run out of time, we will collate all the questions that come in and make sure they're answered, and they will go up on Health Pathways, and we'll notify you as to when that will happen. We'd like to hear your feedback on the usefulness of the webinar at the end of the time. Now, the first speaker tonight is Matt Hamner. Matt is the, sorry, I'll just grab this here. Matt is the vaccination program lead for the Northern Region Health Coordination Centre. Matt was Director of Strategy and Transformation at the National Health Service in London and has a background in health economics and health policy. Came to New Zealand in 2017 and is the General Manager of Primary Care at County Manukau. So Matt, I'll hand over to you.
Kia ora koutou, just making sure everyone can hear me. Just like to also add my thanks in to everyone for attending tonight's webinar. I've got a presentation here. I'm just going to run through a few slides. Can everyone see that okay? It's coming up all right. So yeah, look, I'm just going to give a bit of an update on where we are. I would like to just echo the thanks to everyone who's done absolutely amazing job getting Auckland vaccinated. As you can see from from the slide here, we've done over 1.5 million doses in Metro Auckland, and we've really seen record rates of vaccination over the last 3 to 4 weeks. Certainly a week or so ago, we were vaccinating just over 30,000 people a day, which is pretty incredible. Before the lockdown, we were around about 16,000 doses per day. So we saw a significant doubling really of our capacity across the city. We've reached a point of about 68.4% first dose coverage, but as some of the things that we're going to talk about today, that's not yet equitably distributed. Dose 2 coverage is just over 36%. And again, what we're seeing, and we'll go into this in a bit more detail, is that for our Kaumātua, we have achieved really good rates of coverage and near equity with non-Māori, but it's particularly in the younger age groups that we're focusing our attention in terms of how we support that. We've got 14 community vaccination centres up and running. 5 of those are Māori led by a couple of Māori organisations, and 2 are Pacific led. We've got a significant number of GP clinics up and running now, and vaccination pharmacies rather. We really have been seeing incredible work from everyone involved in the programme, with really high levels of satisfaction from everyone who goes through the centres. We've also added on a number of new settings over the past couple of weeks. So we are bringing more and more primary care on every day, and Leanne will update on that. People will have probably seen the park and the drive-through vaccination centres that we have established. So the largest of those is at the park and ride at the Auckland airport. Papakura Marae has a large drive-through facility at the marae there, really part of that kind of holistic offering there, both testing, kai and vaccination. The North Shore Aerodrome has been stood up as a vaccination drive-through, really supporting that Hibiscus Coast. And then the Trust Arena started out as a drive-through centre run by Waiparera, and that has a kind of a hybrid model now where they do a lot of vaccination inside the building there, but they also have maintained that sort of drive-in capacity as well. So we're also doing a lot of pop-up work, mobile and outreach models. And in fact, where we're at now is really thinking about how we extend that. So where we're at now is we've got a lot of capacity in the system. As I mentioned, we can do between 20 to 30,000 vaccines per day. We can do up to sort of 220,000 vaccines per week, sorry. We are really looking at how do we orientate that capacity to serve the community and doing more outreach where it's required. We have seen that increasing, and what we're now seeing is we have a lot of capacity, and we need to do more to make sure that that capacity is filled every day. And we're also looking at how we support a more equitable uptake, particularly in the younger population. So coverage really varies by ethnicity and age across Auckland. So we can see, and we've done a lot of detailed analysis on a sort of a borough by borough, suburb by suburb, mesh block by mesh block basis, really trying to identify where we need to focus our effort. And again, this is something I think going forward, we're really keen to continue to work with primary care on, particularly when we think about the broad coverage that we've got across the network there, particularly how we engage younger people, particularly younger Māori and Pacific, to support that equity approach. And as I mentioned, progress by ethnicity has been very, very good in terms of Kaumātua and older Māori and Pacific. The graph here showing really sort of consistent rates in that 65% plus. And then we see that sort of drop off as we go through the age groups. Now, some of that's to be expected given that we've only just sort of started focusing on younger people, but already we can see that we need to substantially increase our focus on Māori in order to reduce those inequalities. So I think what part of today is about is sharing some of the great work that's happening there, to talk about some of those experiences, and then we're looking forward to continuing to partner with primary care as we go forward. As I mentioned, we've got a lot of capacity now, so really it's just about making sure that that's optimally configured. We can also see that there's about 300,000 people across Auckland who haven't yet engaged with our services. So whilst we've got a lot of people who've had both dose 1 and dose 2 or dose 1, we also have a lot of people who have a booking in the system for a vaccination in the future. There are about 300,000 people who have not engaged in any way. And I think, again, tied with the kind of coverage analysis that we're doing, we're really focusing on how we reach them in new and innovative ways. And some of that will be talked about by the team today. And I think that's my bit.
That's great. Kia ora, I'm Leanne Curtin, and I'm been involved in rolling out this primary care program here for the Metro Auckland region. And I just want to acknowledge that we haven't done this alone. We've had the support of our PHO partners and obviously the amazing support of practices across Auckland and other NGO providers. We thought this would be a useful map to show, because you can see the spread, geographically across Metro at Auckland and further to the upreaches of, the upper part of our region through to Wellsford. And so we've got quite a lot of capacity. We've even got a facility out there in Great Barrier Island, which is just off the map there. But what we do is continually reassess where there are gaps and try and work with our providers where possible and work out how we can best fill those gaps, both in terms of rurality but also equity from a Māori Pacific and obviously increasing focus on getting the younger people immunised. So we are continually reassessing this capacity and working out how we can best reach those populations that we're not seeing the results we need to see as yet. So just in terms of where we're at now, 122 GP clinics now live, and I can say that I was rapidly updating these figures this afternoon. It's now 124, so they're coming in thick and fast today. And so obviously we've got approximately 100 or so onboarding. And exciting also, my community pharmacy colleagues have been working really hard, and also got 51 pharmacies now live, with 81 pharmacies being onboarded. So the whole sector, primary care sector, has really stood up and responding fantastically to this challenge. So what I'd like to do now is introduce Louise Robertson, and she's the clinical nurse lead projects and change at Alliance Health Plus. She is Samoan, New Zealand, European registered nurse with extensive health experience, working across both primary and community care within the District Health Board and within PHOs. And I've asked Louise to talk about this onboarding process from her perspective, because she's been working really closely with their practices, and it's been running like a dream really from my perspective. So I thought she was best placed to talk to this. So good evening, Louise.
Thanks for that, Leanne. Kia ora koutou, everyone. Just apologies for the issue with my camera tonight. Thanks to NRHCC for asking me to come in along this evening to talk a little bit about the current COVID vaccinating onboarding process for general practices in Auckland. I've been involved with the onboarding since the beginning of this year, when the PHOs started working together with NRHCC to roll out the COVID vaccination program to what we called Tranche 1 general practices at the time. So a lot was learnt from that initial group of practices, which really paved the way for other practices. And together we've been able to streamline the process and make it more simple and fit for purpose for primary care and general practice. So the PHOs will have a key person leading the rollout, and someone from the team would have been in touch with their practices with information regarding the process for onboarding. And practices can express their interest with their PHO that they wish to provide the vaccinations. So while we aim to make sure all clinics get the opportunity to onboard if they're able to, the rollout leads from the PHOs have continued to prioritise general practice rollout based on equity considerations, such as the vulnerable populations enrolled in the practice, with a particular focus on Māori and Pacific patients, as there continues to be an equity gap with those ethnic groups. Geographical locations, so this includes vulnerable, diverse communities, communities with high Māori and Pacific, and just ensuring there's a good spread of locations across the region to help with increased access for all. And of course, there's got to be consideration of general practice sites' readiness and capacity to onboard, which includes things like having good control over BAU activities, having a suitable environment and space, and sufficient resourcing and staffing. But it's really important to have these initial discussions with your PHO, as although that there are processes and guidelines to follow, models of care can be quite flexible and adapted to suit a range of different general practices, just as long as safe processes and practices can be demonstrated. And the NRHCC clinical team have been really helpful and are open to discussions around different models of care, and they're happy to provide extra support and advice as well. So the first important piece of documentation is the facility setup form. So this needs to be completed by the clinic and get sent to the Ministry of Health for approval to set up as a COVID vaccination site. And this can take up to 5 to 7 days. So once this has been approved, it allows for the other setup processes to happen. There is a national booking system application form that can also be completed at the beginning of onboarding or at any stage throughout, if clinics are interested in joining the national booking system. And this might be more useful to clinics right now, as you might find a large number of enrolled patients might have already been vaccinated elsewhere, and you can open up booking spaces to the national booking system once you've done your enrolled. Relevant clinical and non-clinical staff, so these are your provisional authorised vaccinators and admin and observers, need to complete the appropriate IMAC, COVID and CIR e-learning. Once the e-learning has been done, then we can send off the details to get CIR access. And it's just important to note here, just to make sure that your staff have individual business domain email addresses for CIR access. And with this, you'll also get access to a CIR classroom version, which you can have a play with some mock patients. A clinic individualised site plan, which we call an SOP, must also be completed and signed off by the PHO clinical lead. So this is quite a detailed document, which will be your clinic's operating procedure manual alongside the Ministry of Health guidelines. The PHO will be able to provide an online link and guide you through the online ordering of consumables, collateral and resources for your COVID vaccinating setup, and then also provide information and documentation and connect you with the vaccine ordering team, who are really helpful with supporting clinics through the vaccine ordering and stock management process. In addition to your current cold chain policy, there is a specific COVID vaccine cold chain template, which is also required to be completed. Clinics will walk through all these processes by their PHO team, who also undertake as many site visits as necessary to provide education on things like vaccine preparation and getting familiar with CIR. We also ensure documentation is complete, orders have been arranged and delivered, and assess site setup and readiness just to make sure you're well prepared for the quality assurance assessment, which we also call the wet run, where you vaccinate actual patients. The quality assurance assessment is undertaken by the PHO and covers areas like staff training, clinic preparation and setup, daily planning, infection control, drawing up of vaccine and disposal, cold chain compliance and consent. So once the QA assessment is passed, the report is signed off by the clinical lead at the PHO, and then a request to go live is sent through to the NRHCC clinical team. More often than not, the formal approval will come through on the same day or within 24 hours at the latest. Then you can go ahead and start booking and vaccinating patients. So on average, the onboarding process can take around 2 weeks. So once gone live, the clinic information regarding COVID vaccinating needs to be updated on your health point. Clinic details can be added to the NRHCC website, and the transition process can begin for the setup on the CIR inventory portal, where ordering of consumables and vaccines and stock management can happen. And the vaccine ordering team will support you through this again. And just to finish off, I'd just like to say that I've really admired the commitment and motivation and patience that primary care have shown in relation to everything they do, but including providing this important vaccination program. Thank you, Leanne.
Thank you, Louise. Appreciate that. It's a really helpful outline of the process. So I just thought that we'd move on, and there we are. So basically what we've done is we're continually reassessing this process so that we can streamline it as much as possible. And as Louise said, we've now got a 24-hour turnaround system at the most for clinical sign-off from the NRHCC. And also we've also done that with the CIR access. That turnaround's also improved markedly since the program's fruition. We also thought of other ways to make it easier for practices, and that includes pushing orders of vaccine and consumables prior to the readiness assessment, so that that's just one less thing practices have to do and get familiar with before they go live, as it were. And we also have 2 different teams supporting both practices to help get set up on the national booking system, and also onboarding onto the CIR inventory portal, which is how sites basically order vaccine and consumables once they're up and running. So you know, we're doing all we can to try and make this process as easy as possible for practices. So, and if there's any other suggestions, we're very welcome to hear them. So we want to make this process work for you.
Okay, thank you for that, Louise and Leanne. So now I'd like to introduce Carl Snowden, who'll talk about our Māori approach, and Gloria Faison-Clewett, who'll talk about our Pacific approach. Carl is the Māori lead for the Northern Region Health Coordination Centre, managing the rollout of the Māori regional COVID-19 vaccine program. Carl has extensive experience working for and with Māori providers, and recently Māori program manager at the Auckland and Waitemata DHB's planning, funding and outcomes team. Gloria is project manager with the Northern Region Health Coordination Centre. Gloria is currently working within the Pacific team as part of the vaccine rollout. She has worked across the COVID-19 response in the outbreak and managed isolation and quarantine teams. So I'll hand over to Carl.
Tēnā koutou katoa. ko Kausnode in tuku ingoa, he uri hau no te tai toke rau. Look, I'm just going to give a quick update on sort of obviously the situation that we're in for Māori. Matt did cover a lot of the key sort of points, but I'll just dig down a little bit deeper. Obviously, so far, we know that sort of nearly half of the Māori population in the Metro Auckland region has had their first dose, and only a quarter their second dose. Over, I suppose, since the beginning of the lockdown, we have seen increased numbers of Māori coming into the sites, and we're now starting to see over 10,000 Māori a week over the last 3 weeks, which is was very, very positive. As Matt said, we have had high vaccination rates for Māori over 65 years old across the region at the moment, and obviously that's a really, really positive thing for us. In terms of increasing vaccination across the region, there has been a lot of movement in the rangatahi area, although, like it says, there's the change observed this week was smaller compared to the week before. The drive-through sites, we stood up the drive-through sites during lockdown, and they have really appealed to Māori. Māori have driven up to these sites in large numbers. Others have too. So in terms of a proportion, we haven't had the proportion we wanted of Māori to everybody else that have come. But in terms of raw numbers, more Māori have turned up to the sites to be vaccinated over the last 3 weeks. And we're also sort of very, very positive around the numbers that have been turning up to the GP clinics. As it says there, we still have a huge mountain to climb in terms of the gap between Māori and everybody else and the vaccination rates that we have at the moment. We, as you saw in the heat map that Matt showed in his slides, that there are a lot of areas that we need to still focus on. I think we know that the priority area right now is still South Auckland, and there are a lot of suburbs in our top 10 that are based out in South Auckland. So we do have a lot of work to still do out in South Auckland. Next slide. In terms of what we've been doing, we've been looking at sort of obviously a bit of a targeted approach for Māori, and there's 2 areas that we're sort of obviously being focused on. The supply, I think we are in agreement that at the moment there's a lot of supply in the system at the moment. The drive-throughs have offered a lot more sort of opportunities, we believe, during lockdown, but we also have that in terms of access, Māori have accessed the community sites the most, and obviously they're starting to access GP clinics more too over time. We also did see quite a large number of Māori access their pharmacies, which was kind of positive too. However, what we do know is that as we move on and we have to look at sort of trying to reach the harder to reach whānau, we are going to have to look at outreach models, looking at pop-ups in certain communities, mobiles. I think at some stage, once we can get ourselves out of lockdown, we would like to possibly turn up to people's homes. I think piggybacking off the amazing work that our Pacific team have been doing, that you guys will hear about soon, we want to also sort of start doing some of our hāhi, our churches, and vaccinating some of our whānau there, and also looking at other groups that are going to be hard to reach, and reaching out to those groups and prioritizing them. Groups like the gangs and others that we know that aren't going to turn up to our sites. The other sort of conversation too that we've been having across the region is how the providers would like to sort of run a hybrid model, where some days they look at sort of large volumes, and other days they are sort of pushing their teams out into the community to be able to sort of get those hard to reach whānau. In terms of demand, one of the things we have seen is that we have a lot of capacity in the system. We've even gone as far as booking out capacity in the system and reserving it for Māori in our community sites. And yet we need to do a whole lot more work to encourage them to come. I think this can be done by sort of, prioritising whānau and actually getting them in groups. And actually prioritising them by allowing them to come in whenever they need to, once they feel comfortable. We've been looking at trying to work with our community groups to sort of engage those hard to reach communities through our mana whenua and our iwi, through our Māori providers, to get them to get out into those hard to reach communities and get them to encourage them to come in. Like I said, we do believe that we have a lot of capacity in the system at the moment. We just need to try and find a way to encourage our whānau to come in. One of the other things we've been looking at is trying to do outbound calling. So actually ringing up our whānau to understand the situation on why they're not coming, and maybe giving them some information or encouraging them to come in to each of the sites. And a lot of our providers would like to be doing some of this work. And obviously there's a lot of comms work happening across the board, not only in the centre, in the region, but we also have our providers and our DHBs also working on comms to try and drive, like I said, our Māori whānau into our sites. The last thing, obviously, that isn't on the slide that we're really keen to do too, which is starting to happen more and more often, is we're lucky enough to have some of our leading clinicians come out and meet with our communities and talk about COVID and give them the messages. So yeah, that's it.
Nisam Bulavanaka and Paul Maria, everyone. I'm Gloria and I'm part of the Pacific team at the NRHCC. So just leading on from what Carl was saying, I think there's a lot of similarities across the program, especially as Matt and Carl did mention, we've had a huge increase since the outbreak in Pacific people actually taking up vaccination. As the rates say there, we're now up to about 54% of our Pacific people having had one dose, and to a lesser degree, about 28% are fully vaccinated now. With the lockdown, we've seen a growth in our outreach program as well, which is initiated just before lockdown. And this has given us a chance to prioritise our family members who are able to either come in as a whole group or book through what we've got there is 0800 number. So this 0800 number has been an initiative that we've set up to provide language-specific support for Pacific people. And in this instance, we've seen in some cases a family of up to 30 people being booked in one time. As we know with the booking system itself, we kind of have some difficulties around doing that, but this line has actually been really, really beneficial in getting our Pacific people booked in the numbers that they want in a way the community has asked for. With those outreach programs as well, we've had quite a few big events, and I think it's important to note that they actually are, in this first instance, is based around the churches and also based around ethnic specific communities. Not to say that we haven't had other people from different communities come through, but this targeted approach within the churches and within specific Pacific ethnicities has increased the Pacific rates overall. We've had the likes of the Mangere e Whakasā Church, which was done just prior to the outbreak. We've had a 4-day event at the Latter-day Saints. In Mangere, we've had the Tongan drive-through, which was amazing to see, such as Carl had said, a younger population coming through, which we've had difficulty gaining that momentum in. And we also saw for the first time quite a high, significant number of Tongans actually turning up. I think over 87% of that population that came to that event was Tongan, youthful, and received their first dose. But I won't go too much more into that because I know Mally's got a few more things to talk about. We've also got other events planned coming up around Cook Island groups, Niuean groups, and then just working with our communities to see what they want. I think it's very important to mention that these pop-up and outreach models have been a combination of both provider-led and community-led. That's been, I think, the cornerstone to their success. The engagement around these has definitely been around our Pacific providers and what we call the Pacific Providers Collective Governance Group. We've got their support and they're working with their local communities to try and drive the work we're doing and informing us on how we do that. In conjunction with the Cause Collective, who are a Pacific communication specialist who are working within the outreach piece that we're doing and engaging churches, youth leaders and community partners. And the main way they're managing to do that is through language-specific radio stations, social media campaigns, as well as youth forums, churches within the youth groups within the churches. That's been really pivotal. And I think the best way to look at all these pieces that we've done is that they all interrelate, they're all integrated, and together they kind of help us see the results we've wanted to see up until this point. So I would like to introduce Mele from here. She's a Nurse Lead Clinical Service Manager from Langi Māori, the Tongan Health Society, who will talk about her experience actually vaccinating our Pacific community within their clinics. Thank you, Mele.
Sorry. Hi everyone. Malloy Lele. My name is Mele. I'm the Clinical Service Manager for the Tongan Health Society Langi Māori Clinic. Thank you everyone for being here to listen to the experience that I have go through the vaccination center from Tongan Health Society Langi Māori Clinic. As you see, my first slide is this our goal to improve the accessibility to the vaccination side and increase the health equity. My presentation will be a straightforward, quick one, just to share with you guys the experience that we went through. Just a little background about Tongan Health Society for those who are here in the webinar not knowing us. We are located in Onehanga, which is our main branch, established in 1997, with a Tongan Integrated Family Health Center. And we have three medical centers across the Auckland region, which is one at Pambu and one at Kelston at West Side. We looking after over 6,000 registration patients. Next one, that's our vaccination center, where we are at Onehanga 29 Hill Street. We have lots of our enrolled patients come through there, which is very great to see them come forward to do their vaccination. Also, I just showed this slide just to see that Royal Highness Mele Siuri Kutapu. She's one of our princes. She's a role model for our people. And you know, in our culture, they mostly look out for those higher rank in our culture. So she really keen to be promote the vaccination for our people, which is really effective in a way that people are looking up and listen to hear a promotion on the radio and on the Pacific program and the BMN and all the media that she's had a video and talking about that. And most of the other slides is some of our leaders. That's her doing a vaccination with one of our nurses on our team. Sorry. Since we started from 25th of May this year, our little vaccination center together with our normal business GB running, we nearly up to 7,000 vaccination that being done in our little clinic. Anyway, last week, the last 2 weeks, as Gloria was mentioning, that we had a big event at one of the big church at Minkri, Whamona Road, which is we come together, the community, church leaders, community leaders, and some of the stakeholders that we are working together and thinking a way that we might help our community. And encourage particularly our Tongan people to come forward to have the vaccination, which is very great. We have a good experience on that, and I think it's very successful for our people doing the drive-through on the last 3 days last week, which is Thursday, Friday, and Saturday last week. We've been immunized around 3,827. 90.5% of that they're doing their first dose. 59% of that mostly under 35 years old, and also 40% around classified as youth, which is 25 years below, which is very great to see. This the age group they hardly come to the clinic anyway. So it's very great, and seeing them coming through to that 3 days event, which is very grateful for them to come forward and have their vaccination done at the church where we base into our event. Just go through how we do our process of coming through registration and screening, registration and immunization, and then queuing to do their 15 minutes and then discharge from there. But yeah, I think we are very successful on the last 3 days last week, and we're looking forward to do more of that, because our people is more comfortable coming with their own bubble in their own cars, which is understandable with the lockdown that they can't go anywhere, but it's allowed them to come through and do their vaccination through this time of lockdown, where some of them are not going to work, or they mostly at home. So yeah, it's really grateful for me as a Pacific nurse, and being a nurse leader from one of our Tongan Health Society clinic, and I based at Onehanga, which is very grateful to see our people. However, we keep on going with media and other radio programs to still encourage people. We know there's lots of media anti-vaccine that's influenced, and our people are not really keen to come forward and do the vaccination. However, we can see when we come together as a community, it's very strong, and they do it very well. Thank you very much for your time. Listen to me, Ofatu from Melevaka.
Okay, thanks for that, Melee. It was great. Now I'd like to introduce Michael Hammond from the NRHCC. Michael is a project manager and pharmacist for primary care Waitemata and Auckland DHBs. Michael is currently working with the pharmacy establishment team to manage the rollout of COVID-19 vaccines in community pharmacies across Auckland Metro. He is an experienced project manager and clinical pharmacist who has led a number of health projects. So Michael, you can take it away.
Thanks, Brian. So yes, hello everyone, I'm Michael. So I'm just going to give you a relatively brief update tonight on where we're at with the rollout in community pharmacy. So we've achieved an awesome number of vaccines throughout the Auckland Metro community pharmacy vaccination sites, hitting over 160,000 doses, with 51 pharmacies live as of today, actually, with about another 10 more expected to come on live this week, and more planned over the coming weeks. We've got 6 sites who are approved as outreach providers, and we are continually looking to engage with our other current flex providers if they're interested in providing outreach as well. And then just adding to that as well, we've got about 90 community pharmacies who are at various stages of the onboarding process. So we've got our work cut out for us as we try to onboard as many pharmacies as possible over the coming weeks. And we're aiming for around 150 pharmacy vaccination sites in total, which corresponds to all of the current vaccinating pharmacies in Auckland Metro. Our community pharmacies have been doing some really exciting work outside of the pharmacy as well, providing quite a number of outreach and off-site vaccination initiatives. There have been quite a few temple pop-ups provided by Uniki and Pakarangi Pharmacy, and just this weekend gone there was pop-up at the University of Auckland provided by the Unichem Campus Pharmacy. So to pharmacists thinking about coming on board, or those who are already on board, if you want to do outreach, it's a discussion that we are more than willing to have with you and to help you think that through. We are continually trying to streamline our onboarding process because we understand that it's quite intense. So we're continually refining this and working towards a much faster model. And part of this is working with our sector partners, those being the likes of Green Cross Health, Chemist Warehouse Group, Totem, to provide some additional quality assurance support particularly for the assessments, so that we can get more sites on board faster. If sites have any questions about making changes to how they provide the service at their existing vaccination site, or are still interested in completing an expressions of interest to onboard into the program, please send any questions through to the Metro Pharmacy inbox that's displayed on the screen, and we'll be happy to get back to you. That's all I've got to say. Thank you.
Thanks for that, Michael. Okay, so our final speaker to talk about general practice is Tim Malloy. Many of you will be familiar with Tim. He's a rural GP and Director of Coast to Coast Healthcare based in Wellsford, North Auckland. Tim is currently Chair of GenPro, the General Practice Owners Association of New Zealand, and on the National Prime Committee, and has previously held many distinguished roles, including past President of the Royal New Zealand College of General Practitioners. He spent the last 34 years with his colleagues building a large team of primary care providers across a network of clinics spanning rural North Auckland and Lower Northland. He's here today to talk about the approach and experience, his experience of providing COVID-19 vaccinations across his practices. So I'll head over to you, Tim.
Kia ora katoa. Thanks for that introduction, Brian, and welcome to everybody joining us. I'm just going to share my screen if I got it right. Wrong one. My apologies, I can't seem to put up my slides. I'm not sure what's happening.
It was actually coming up, Tim. Yeah.
The actual slides?
They did just before, yeah.
Okay, right, we'll try again. Share screen.
Okay, that's come up now, Tim. I don't know if you can see them.
I can't see them. That's fine. Look, back in April 2021, it became clear to us that for the vaccine rollout to succeed, the DHBs would need to engage with community health services to expand the reach, especially out of the metropolitan areas. At that time, our services were incredibly stretched, providing our usual general practice and urgent care services, and our workforce was under a lot of pressure. When we were offered the option of setting up a vaccination centre, we felt that this was essential with our population about an hour's travel from the city. We consulted our fellow trustees in Coast to Coast Health Trust, made up of ourselves, our Māori health provider Te Ha, and the community. They agreed to progress. Our planning included the following conclusions. We needed to be separate from our clinics who we were already strained by business as usual and swabbing. With a large turnover, we would need a big car park with easy access. We also needed a central location so as to do it once and do it well, as we knew this would be at least the whole of this year, if not next, for boosters and children. The only location available was the large meeting shed on our community garden site with its associated lean-to. We spent the next 4 weeks coercing local tradesmen into helping us, and they were great, especially when they knew it was to provide a COVID vaccination locally. We built the new clinic space and internally fitted out the consent area and recovery. We painted and decorated, put in heat pumps, furnished and equipped, including full resuscitation facility. And started tentatively after initial dry run, finally vaccinating on May 25th. Alongside the structural change, we needed to build a workforce. We were incredibly lucky when the community heard we were planning a service. Many of our retired clinicians put up their hands to help, including a retired GP, a number of nurses, but also other health providers found time to volunteer their days off, e.g. a midwife. Some needed additional training, and this became our focus. But what we also need was a group of administration. To help with greeting, consenting, data entry and monitoring. While we had recruited a coordinator early on, we turned to our local WINS office to help us with a group of individuals who soon learned the intricacies of the CIR, etc. The WINS office came up trumps for us. Our next challenge was that the National Booking Service was still in development at that time, so we quickly had to build our own in medtech. Unfortunately, this shifted the burden to booking onto our clinic receptionists, but by spreading it across the whole team, we were able to make the load more bearable. It was in our initial planning to build the capacity to grow, as we knew that at 3 weeks the demand would double with the returning vaccinations. So we began slowly and built up over time to the point where we are doing approximately 320 per day, 5 days a week. Lockdown level 4 has made it possible for everyone to access bookings, and so we haven't needed to extend the weekends yet. The proliferation of alternative providers of vaccines have meant we are now having problems with DNAs, up to 50 a day recently, but equally appointments are available every day. Recently, we have, as a practice, started contracting out more at-risk patients and offering to help with booking an appointment to ensure anyone has an opportunity. These pictures are of our first wet run. This is our first patient that we vaccinated. The previous pictures were of the first vaccine delivery. And as of now, to date, we have completed 18,000 vaccines. Our vaccination rates for our practice include over 82% of our enrolled patients over 65 so far. Thanks for your time.
Great. Okay. Thanks for that, Tim. 18,000 vaccines is a pretty phenomenal effort. So we've got time for just got 10 minutes time for some question and answers, and there are some questions that have come through, and I think a couple of them are quite interesting, do need perhaps answering. One of them that has come through a couple of times, just looking at, so I'll just grab them up here. So one of the questions is, does there need to be a delay in giving the vaccine if people have had COVID? And there's another similar question. We've had a Pacifica family who've all got COVID and are MIQ. When should they have their first vaccine, please? So I don't know, Matt, whether you've got any answer to that, or anyone else wants to answer that?
Kia ora, Tim, Brian, sorry. Yes, look, our clinical director's not on the call today, so I know there is guidance around there. I also understand that the processes in the MIQ now mean that people are given information about that and even help to book an appointment. I understand there is an interval, but what we'll do is we'll flick that around in an email, Brian, if that's okay, just so we can get that officially signed off.
Great. There's another question here which is quite interesting, and I don't know, Carl and Gloria got some comments on this, or even Tim. I think the elephant in the room is conspiracy theories, obviously what's happening on social media at the moment or on the internet, which is contributing to vaccine hesitancy. And I suppose it's been one of the concerns that there'll be large uptake up front, and as it gets into those more difficult to reach patients and people, and especially those with perhaps views that are hesitant about the vaccine, what can be done in this area? Does anyone want to comment on that? Because it is a very live topic at the moment.
I can jump in, Matt, and help. And so one of the things I was suggesting at the end of my kōrero is that we're running hui with the whānau that are looking to come in with our clinicians to answer some of those really hard questions, to answer some of the stuff that people are seeing on Facebook about the vaccine, and allowing them to talk to the people that, you know, some of the trusted voices, I suppose. And I think that from our point of view, that's the key, is get the trusted people in front of them. In terms of my own experience, I got my own family over the line because they felt like I was a trusted voice. So yeah, we're just trying to get trusted people in front of those people.
And I'd have to resonate what Carl was saying there. I think the biggest thing for our Pacific population is people of influence, leaders within the community, having them share the message or promote the cause that we're trying to lead here. I think the other thing we've had a lot of success with is discussion panels from Pacific professionals. Again, it's those community leaders who are really influential.
Yeah, I'd probably back that up. Certainly our experience in Paurua has been often, if there is a relationship with their community provider or community medical centre, actually one-on-one conversations with either the nurses or GPs or people they trust or know have got a relationship, makes shifts thinking quite quickly. So really, really important, that relationship trust side of things. There's another question here, which Matt, you might want to answer, which I think is again quite interesting. Can you send us, that is GP clinics, a list of our patients who have not engaged with the vaccine interface at this point?
Yeah, absolutely, Brian. And so yes, we can do that. We send that information to PHOs. It's just something we've just been able to recently unlock through the various data sharing protocols that needed to be in place. That information gets sent out, and then I think PHOs will be sharing that with their practices. Leanne, I think is the process there.
Yes, that's right. We've only just worked through those various permissions, and we've had the data cleaned, and so that it's now available for PHOs, and it will be uploaded weekly. So they'll be able to get, you know, quite recent data and refresh it to practices. And so that's been great that we've got that through.
Great, excellent. Hey, thanks for that. There's another one here, which I don't know who wants to answer this one. Maybe Tim, I don't know if you know the answer to this. Do all vaccinating doctors and nurses need CIR training or access, even if the nurses are going to be mainly involved in administering vaccines? So if you have GPs on site who are not, do they have to do the CIR training?
Short answer is probably not, but they should, because it's not that big a deal. It's not hard, and in my view, they should.
Hi, it's Leanne here. Look, it's sort of wrapped up as part of the IMAC training, so that which everybody, you know, has to do, whether they're a vaccinator provisional, authorised, or involved in the administration sort of side of things. So, and it is just a short component of it. And I think what it does give clinics is flexibility, because you know, we all know sometimes how staffing can change, and so obviously the more people they're familiar with the system, the better. Really, it just provides clinics with flexibility.
Yeah, great. I actually agree with that. I think everyone at our clinic has gone through the training, even if the GPs aren't doing the vaccinating, and I think it does provide flexibility and understanding of the process. Just another question here. We've got time for another couple. Many providers and staff feel that the CIR program is unduly complex for a busy GP practice. If you are wanting to streamline this process, has any thought been given to simplifying this?
Kia ora. Look, we are, obviously this is a new system, and so like any system, I'm sure that, you know, we will continue to, or when I say we, it's obviously a national system, but I'm sure there's opportunities to evaluate it, and so that, you know, if people do have specific suggestions about how it could be improved, or, you know, do feed them through, because I will send it through to our CIR team. And you know, I think that, you know, if there's a theme that resonates, then you know, then change will happen. So so thank you. Yeah, do feed any suggestions through.
Yeah, the systems, there's enhancements going into the system all the time. You know, and there's things that you can do now that you couldn't do a few weeks or even months ago. So yeah, just feed those through, and we'd be very happy to feed them up to the ministry, and they can be programmed in as part of that enhancements roadmap.
I think that's a really important point. Feeding back from the front line in terms of what's going on, and I know the process since it started has certainly simplified considerably as people have got up to speed with this, and certainly the CIR is one of those. So yeah, I'd really reinforce just feedback to the PHO or through to the to the coordination centre on those issues. Kia ora, do you know the denominators for Māori and Pacific populations, and are these stats related to Metro Auckland, please?
Yes, I think I popped those in the chat. Yep. I think it was 100, so it's no worries, I'm just trying to find it. I think it was about 123,000 for Māori and 165,000 for Pacific and Metro Auckland. And Gloria and Carl gave the sort of the percentages of sort of total against that. But as both Carl and Gloria indicated, it's a very mixed bag when you look across the age ranges. And we've really got a lot of work to do with that sort of the younger part of the population now.
And you know, we'll just let you know that we are going to respond to these.
Okay, thank you.
Yeah.
Sure. So just looking at, just a comment on the site plan is very time consuming. Treats GPs like we've never vaccinated before. It's just a comment that's come in. Any comments on the site plan?
Yeah, I mean, as I said right at the beginning, we are continuing to refine the process. So look, again, if people have got specific suggestions as to, you know, what part they feel is, you know, cumbersome, just feed that through to your PHO or to us directly, and we are continually to refine it. So we've made a number of iterations. So just we'll continue to refine it. Yep.
Great. So again, it's that feedback process. I think that's really important here, just to keep that going in terms of getting this across the line. Just a comment here on IMAC gives really good, clear advice. So it's a great resource to use. And it goes back to that question about COVID vaccines post-COVID infections. So I'd back that up. I think the IMAC resource is really useful for a lot of these clinical questions that we get. There's another comment here, amazing work, Malloy. So that's a compliment back. So look, I think we've just about run out of time. I think it's been a really useful webinar to get an overview of what's actually happening in the Auckland region. This is incredibly important work, both for Auckland and for New Zealand as a whole in terms of moving past Delta. We won't get past Delta until we have our vaccination rates very high in this country. So I think I'd like to thank all the panelists for the time they've spent with us and giving the overview. I think it's been great. And in particular, all those who's been listening, obviously the work that's going into vaccination in the community is so important for what actually happens next. And as we move into next year. So look, thanks for all the amazing work that's been going on. Thanks for the time listening to the thing. This will go up on the website, so it'll be available to look at. And all the questions will be circulated with answers on health pathways over the next few days. So look, thanks very much to everyone, and until next time.
Thank you.
Ka kite.